Thank you very much, and good afternoon. So it is a most challenging time for us right now, and today is going to be a day for us to reflect and to make some change. First off, we have a number of updates around the cases. Since Friday to Saturday, we had 936 new cases diagnosed in British Columbia. Saturday to Sunday, an additional 805 new cases. And in the last 24 hours, 774. That's a total of 2,518 new cases of COVID-19 diagnosed over the weekend, bringing our total to 98,165 people in British Columbia. That includes 816 people in the Vancouver Coastal Health Authority, 1,280 people in the Fraser Health Region, 142 people here on Vancouver Island, 156 people in Interior Health, 121 in the Northern Health Region, and 3 people who usually reside outside of Canada. We now have 299 people in hospital across the province, 79 of whom are in critical care or ICU. And sadly, again this weekend, we've had 6 people who have died from COVID-19 in British Columbia, bringing the total number of people who've died from COVID-19 to 1,455. Our condolences and our thoughts go to the families and the communities who are mourning their loss. We have 3 new outbreaks as well in British Columbia at the Abbotsford Regional Hospital, Prince Rupert Regional Hospital, and Long Lake Chateau. The outbreak, however, at the Surrey Memorial Hospital has now been declared over. So we do have 4 active outbreaks in long-term care, assisted living or independent living, and 9 now in acute care facilities across the province. Also of concern, as you've heard, we've had 329 new confirmed COVID-19 cases that have been identified as variants of concern. And that brings that number up to 2,233 cases. Of these, 413 are active now. That indicates the proportion of these that are now affecting people right now. And most of these are the B117, the UK variant, 1,915. And of course, we know that this is a variant that is much more transmissible, and we're getting more and more evidence leads to more serious infections in younger people. The number of the South African variant, the B1351, remains fairly low at 48, but also of concern, we've seen an increase in the P1, or the variant that's associated with Brazil, to now 270 cases. And that is also a concern, because we know this variant not only is more transmissible to people, but also has been shown in some parts of the world to be less amenable to the vaccine. So it is important for us to take measures now to stop the transmission of these important variants in our communities as our vaccination program is ramping up. We are concerned that these are driving much of our current transmission, and I'll speak to that in a minute. To date, and I know Minister Dix will talk a bit more about that, we've delivered 699,092 doses of all 3 of our COVID-19 vaccines across the province. Of those, 87,289 are second doses, but we are making good progress with getting the important protection from the first dose into more and more people across British Columbia. As part of our vaccination program, we have a very robust pharmacovigilance, or vaccine safety system here in British Columbia, and you've heard me talk about this many times. Every single dose that goes into an arm in British Columbia is recorded so that we know what vaccine, what lot number, and if there's been any effects from that vaccine, of which are allergic or anaphylactic reactions. However, we have been monitoring not only what is going on in British Columbia, but working closely with our colleagues across the country, with Health Canada, the regulator, and the Public Health Agency, to make sure that we understand the safety of vaccines across the country. And the regulator and Health Canada are involved internationally to understand safety of vaccines around the world. Over this past week, a signal was detected in younger people in Europe using the AstraZeneca vaccine. While the instances are rare, this is a very rare condition with tens of millions of doses of this vaccine being used. We are taking the precaution of suspending the use of this vaccine for people who are under age 55 for the next few days. Health Canada has issued what they call terms and conditions to obtain more information from AstraZeneca about the risk-benefit profile and what this might mean to people here in British Columbia and in Canada. NACI, the National Advisory Committee on Immunization, has again, over the weekend, we've had many discussions, and today, because we have alternatives for people under the age of 55 in this country, we have met with our Council of Chief Medical Officers of Health on this issue several times in the last few days and have agreed to take this action together until we get that assessment and understand what the risk may be. We anticipate that we will have more information in the next 2 to 3 days. Health Canada is working closely with the European medicine agencies and the UK to understand what this means in those countries and if there are implications for people here in British Columbia. This is our safety system working across the world and in Canada. It means that we are taking immediate action when we see a signal to protect health, to make sure that we understand this and that we use this information to appropriately use the vaccines that we have. This is a rare instance of what's called vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT for short. There's been less than 30 cases identified around the world, primarily in Europe, but it is a serious condition and could lead to serious outcomes. So we are acting decisively, unified across this country, to pause the use of this vaccine in people under age 25 right now until we get this additional information. We have other vaccine options and we will be using them, as we've said. Basically, right now, if you have received the AstraZeneca vaccine and it's more than 20 days since you've received it, there is no concerns. If you have received the AstraZeneca vaccine and you develop symptoms that are concerning, such as headaches or swelling, and we have a list of those symptoms on the BC CDC website, you can seek medical attention. What we do know is that this is very rare and it is unlikely we will see any cases here in British Columbia or in Canada, but it is also a condition that we have a test for and there's treatment. So we will be updating our information about that and it'll be available to everybody today. We have also passed information on from Health Canada and from the regulators to clinicians across the country so that we know what to look for in these if one of these rare instances arises in Canada. We will know much more about this in the coming days and be able to update our programs and our advice to people as we attain more information about how this works. The other thing that is important, we have time to understand how this will affect second doses in people who have received the AstraZeneca vaccine. It is very likely that second doses will be available, but we have time between now and 3 to 4 months to understand the implications of this. I also want to make it very clear, this vaccine is an important vaccine globally and in Canada as part of our immunization programs, and we know from the studies that have been done that it is safe. We now are looking at our safety signals and taking action until we have more information, and we'll be providing that as it comes. So while the COVID-19 virus continues to challenge us, our goal throughout the pandemic has been to find here in BC our balance. We want to protect those who are most vulnerable and keep as much as is safe to be open in our communities. As a result of these recent increases and what we've seen about the increase in variants of concern, our balance in BC is now off. And this is a very challenging time. In the last 6 days, we've seen the start of exponential growth in new cases, We've seen more hospitalizations and more people requiring critical care. And the strain on our acute care systems is ramping up. We do not yet have enough people protected with our vaccines to keep our loved ones and our communities safe. A circuit breaker is now required to break the chains of transmission in our province and allow us to safely move forward through this next phase. Gathering indoors is what is the greatest risk to all of us right now. As a result, for the next 3 weeks, from midnight tonight through to April 19th, I am putting a number of amendments in place. First, indoor dining at all food and liquor serving premises is paused. These locations may remain open for full meal service on patios or for takeout or delivery only. Those who only serve snacks or appetizers must close. Additionally, indoor adult group fitness activities of any kind at gyms, fitness centers, or studios are also paused. Activities in these locations are restricted to individual or one-on-one activities only. Contact tracing has shown us that these settings amplify the spread, and as a result, activities indoors in these locations need to be on hold for now. As the Premier mentioned, we are seeing transmission through social interactions, through social networks, but they are being amplified and transmitted through some of these settings in our communities that have remained open, as much as we have tried to ensure that COVID safety plans are in place and people are following them. If you're unsure if this applies to you, then I'm asking you to stop what you are doing for the next 3 weeks so that we can make progress with our immunization program. The previously announced order variants for limited indoor worship services that we have worked very carefully with our faith leaders across the province will now need to be suspended. It is with a heavy heart that I have to announce this. This is something that we have worked carefully with faith leaders of all faiths, and it is something that I know was important for people. But I cannot, in all conscience, with the increased numbers of cases that we're having and the risk that we see from indoor services, allow these types of activities to happen right now. Our outdoor worship service under the current variants may continue because we know that it is much safer to have these types of activities outdoors. We've also seen transmission directly connected in travel between communities and remind everybody, now more than ever, travel is limited to essential travel for work or medical reasons only. We need to pay attention to this now. We have seen increasing cases related to travel over this past few weeks. We know that people have taken advantage of the weather and the March break to go places with their family. And what that has meant is that we've seen a rapid rise of cases of people have returned to their home communities. And this is important for us to pay attention to now. Additionally, we've seen increasing cases again in the Whistler-Blackcomb area, despite testing and contact tracing and much work that Vancouver Coastal and the community have been doing together to try and support people to isolate and to prevent transmission, and the immunization program that we've started in the worker accommodation in Whistler. Unfortunately, this has not been enough, and we're starting to see cases increase again in that community, and particularly in the past week with the more worrisome cluster of the P1 Brazil variant of concern. We've also seen transmission from travel to and from other communities across BC from the Whistler area. As part of this, we will be closing the Whistler Blackcomb Ski Resort for the same period between now and April 19th. It is critical right now that if you or anyone in your family develops any sign of illness, that you, especially children returning from spring break, and if you have traveled, you must stay home from work or school. Arrange to get tested immediately. We also ask everybody right now to pay attention to how you can work from home, whether this is businesses, unless you have to be in the workplaces. We're asking everybody to take that measure again, to work primarily from home as much as possible. Over the past few weeks, a great deal of work has been put into supporting a number of our school districts. And prior to the March break, we were focusing on the Surrey School District, recognizing that the cases in the community in Surrey have been at the highest levels of any community in the province. We know this has been an ongoing challenge, and that the Surrey School District, those educators and everybody who in our school system have working very hard to ensure that we can support safe in-classroom learning that is so important for the physical, emotional, and mental growth of our children and our communities. As part of the suite of activities and changes and upgrades to the safety plans that were being made in the district, the medical health officer, with my advice, has issued an order to ensure increased mask wearing in schools in the Surrey district. What we have seen with the increasing concern across the province and the increasing concern and transmission events that we're seeing now, and understanding the disruption that exposure events in schools can have, we are now going to be we're going to be updating our K-12 public health guidance to support mask wearing for all students down to grade 4 in schools across the province. We know that this needs to be done in a way that supports children to wear masks at all times when they're in the school setting, and to make sure that we are doing that in a way that is positive and supportive for children. It is one of the many measures that can be used to help prevent transmission in our school setting. Non-essential activities need to be limited to outside only, and with the same group of people. As we've seen, there's been a dramatic increase in transmission between young people around the province, and I know that this has been a most challenging year for young people. It's people who've had challenges with job prospects, with their school being remote, with not having those important connections and celebrations of transitions that we want to have and need to have in our communities. But right now, we are asking you to be part of the solution for this next few weeks so that we can protect more people in our communities with vaccination, and we can bend that curve. Right now, we have said that we can have groups gathering outside with no more than 10 close contacts in total. That does not mean one group of people today and a different group tomorrow. It also means that if you have a work or school group that you need to have contact with, or a cohort, you may need to limit that even further. Social connection is critical for us. I know that. And I know in particular that young people feel that strain of being apart from friends. So I'm asking for your help for this next few weeks. Take an extra effort to be aware, to choose your 10 friends or family members and stick with them for this next few weeks. And if you are gathering outside, even if it starts to rain or snow, as it has, stay outside when you're with your friends. Putting new restrictions and orders in place is always a difficult decision, and I can say that we have been agonizing over this across the province with my public health colleagues for the last number of days. But we know more now, and we know that there are settings that we can safely have activities, and focusing on those safe activities, particularly outdoors with small numbers of people, is what will get us through. At this time, it is a step back from where we want to be and from where we need to be. But when spikes and surges become a sustained trend, We need to take these steps to continue to protect those we love and those we don't know. We need a circuit breaker to stop this virus now. We all have a choice. We have a choice to stay safe, to put our loved ones, our friends, and ourselves at risk, or to protect them. Making exceptions or bending the rules gives this virus the edge it needs and makes it that much harder to get to those brighter days ahead that our immunization programs and our efforts together promise. Let's all of us stay outside, stay apart, be together by staying apart, and stay with our same group of close contacts for the next few weeks. I'm asking you to remember that we can get through this, that this is another one of those challenging times. The miles are hardest when they're closest to the finish, but there is a finish in sight now, and we know what we need to do to get there. And as always, I'm asking you to take this to heart, to continue to be kind to each other, to stay calm even in the face of this setback, and to be safe. Thank you.